Your smile is your biggest asset. You can't afford not to smile. If you're uncomfortable with your smile or if it embarrasses you, it's going to affect your everyday interactions with people. People who love their smile smile big and they smile often. And having a great smile is a huge help with your career, with your relationships, and with your overall self-confidence. If you're unhappy with your smile, I can help you do something about it. My name is Dr. Robert Soto, and I'm a general and cosmetic dentist in San Francisco. One of the best and longest lasting ways to improve a smile is through porcelain veneers. Veneers are thin, custom fabricated tooth coverings that are bonded to the teeth. In this presentation, I'll walk through a few situations where patients chose between 2 and 28 dental veneers to give them their ideal smile. Let's begin with cases only needing 2 porcelain veneers. Our first patient has a beautiful overall smile. Unfortunately, she's damaged her 2 front teeth and had bonding placed years ago. The bonding has discolored, dulled, and looks unnatural. I was able to get an extremely natural and harmonious look with take-home tooth whitening and just 2 dental veneers. Dental veneers, crowns, and bonding won't whiten. It's best to whiten the teeth first and then make the veneers to match the whitened teeth. Because she whitened her teeth first, it looks as if she had a full set of veneers. Here's a close-up of another pair of veneers with whitening beforehand. The veneers were made to replace 10-year-old bonding. Bonding can be beautiful, but it dulls over time and is less durable than porcelain. After 10 years with the veneers, the porcelain should remain shiny, strong, and have changed very little or not at all from the day they were placed. In this last 2 veneer case, we can clearly see how the veneers repaired these broken teeth. Notice how the color of the porcelain is different at the top and bottom of the veneers. To make extremely natural looking veneers, they have to be handcrafted by a laboratory technician who specializes in dental cosmetics. I've collaborated with the same technicians for years in order to achieve these results consistently. Take a look at the gum tissue. The gum shape on the top photo is uneven, and in the lower photo, the gums are symmetrical and nicely rounded. As a part of any cosmetic veneer case, the gum tissue shape is considered and is in most cases altered to give us the best results possible. The veneers look best when the gum tissue is symmetrical. Now let's take a look at a few cases involving 4 dental veneers. This is one of my favorite categories of cosmetic dentistry. We always get drastic results from a relatively easy procedure for patients. In this case, our patient started out with worn down front teeth that have both decay and fillings that are breaking down. She needs the restorations to strengthen her 4 front teeth. In the process, we'll make the teeth as aesthetic as possible. The main way I determine how long to make veneers is by looking at the lips, the face, and the other teeth. When talking, not smiling, a woman should show roughly 3 to 5 millimeters of her 2 front teeth. This varies based on age and personal preference. For men, they usually show about 1 millimeter or more. If no tooth structure shows when talking, it's a sign of aging. For most people, the lower lip has a gentle curvature. Smiles look best when the edges of the front teeth form a curve that matches the curve of the lower lip. Worn down teeth are flat and will conflict with the lower lip curvature. I often see patients who are looking to change their smile without orthodontics, even if orthodontics is a great option for them. Due to time constraints or previous failed attempts at orthodontics, many people prefer to have a faster change with veneers. Not every set of misaligned teeth can be corrected with veneers, but some can. This patient's lateral incisors stick out and are much shorter relative to her other teeth. By placing 4 veneers, I was able to bring out the 2 front teeth and bring in the lateral incisors while lengthening them at the same time. She was thrilled with her results. Here's another case with fractured tooth edges. These teeth were repaired with 4 upper and 4 lower veneers. We got amazing whitening results prior to the veneers with take-home whitening. This allowed us to use a very light colored porcelain as the patient requested. Notice at the biting edge of the front teeth, there's a thin translucent edge. Teeth that are worn or broken often lose this translucency. You want people to think you have a beautiful set of teeth, not a beautiful set of veneers. Details like this will make the difference. Let's take a look at a few cases involving veneers on the front and back teeth. My patient has tetracycline staining. Some children are given tetracycline antibiotics when their teeth are still developing. It results in adult teeth with dark striations. Whitening may help a little, but not nearly as much when compared to coffee, wine, and smoking stains. This photo shows 12 upper veneers. The lower teeth were also veneered to match. Her premolars were rotated and they stuck out. We were able to change the shape of the premolars with veneers. All the chipped edges were repaired, and now she has the most beautiful smile. Here we have a case with 4 uneven and unnatural looking veneers. The canines and premolars are worn down, and the lower teeth are both worn, and there is a gap in the center. My patient wanted to start fresh after his kids commented repeatedly about his teeth. He's also in sales and talks to clients face-to-face often. It's important to have a great smile for that reason alone. With 10 upper veneers and 6 lower veneers, I was able to restore the natural shape of his teeth, close his lower gap, and give him a symmetrical, handsome smile that he'd been missing. He wanted to stick to a natural color, so he stayed away from the bleach shades. I really love these results. I see this situation a lot. My patient's in her 60s. She's consistently had dentistry over the years, a crown here, a filling there, and she has an upper and lower front dental implant. The end result is a nice smile with teeth of all different colors and varying levels of wear. With careful planning, I placed a combination of dental veneers, crowns, and implant crowns. We were able to refresh her already beautiful smile. These last few cases go well beyond cosmetics. These are full mouth reparative and preventative procedures that needed to be done. The treatment prevented these patients from tooth loss and extensive tooth damage in the future. If you look closely at the top photo, you can see dark lines at the edges of the lower front teeth. My patient has worn through all of the enamel on the biting surface of his teeth. He has already lost a molar, and he's going to be losing a front tooth due to an infection. The lower photo shows results of placing porcelain crowns and veneers on 28 teeth, including 2 dental implants. I changed the way his teeth come together and protected his teeth with a night guard. This is going to protect his teeth from this type of damage again in the future. In addition to the functional results, we made sure to give him a truly aesthetic smile. This is a severe dental decay case. Some of the teeth could not be saved. All of the decay was meticulously removed from the remaining teeth, and fillings were placed. Once my patient's teeth were stable and all of the decay was gone, I placed a combination of porcelain crowns and bridges. He still needs a couple of dental implants in these photos. He described the results as a miracle. I think of it as a combination of careful planning and artistry. In this last full mouth reconstruction case, you'll notice the worn down short lower teeth in the before photo. My patient had a traumatic bite relationship that caused him to wear down his front lower teeth almost down to the gum line. I redesigned the way he bites with porcelain veneers and onlays. He now puts less pressure on his front teeth and relies on chewing with his back teeth more. His treatment started with cosmetic crown lengthening by a periodontist to reshape his gum tissue prior to the veneers. Very little tooth structure was removed from these teeth to get these results. The back teeth had porcelain added to them to make them taller, and the front teeth have very thin veneers. These cases take a lot of planning to ensure they will both look great and last a long time. Thank you for watching. I hope you found this interesting and informative. If you'd like to get started on your own cosmetic procedure or would like to learn more about cosmetic dental procedures, then give us a call at 415-398-8555 or send us an email at info@sfveneer.com. Thank you.